So as an MPH student, I had some really great experiences outside of the classroom. Most recently, I worked with the UVA COVID containment team. This was a team that helped contain the spread of COVID outbreaks among academic employees. We worked really closely with the health department, with different medical advisors, and we did a lot of contact tracing, guidance on when people were exposed. It was a really good firsthand experience of infection control and public health work on the front lines. And so that was a really great experience. Another experience that I've had recently is also studying the effect of the MMR vaccine on COVID-19 outcomes. For that project, I've been conducting chart review and analyzing data to see if individuals who received the MMR vaccine had better COVID outcomes if they did catch COVID. So that's been really, really interesting. My first experience here as an MPH student was actually as a hospital epidemiology intern, in which I was studying the spread of hospital-acquired infections over at the UVA hospital. That was really cool because I spent all day, every day, walking around the hospital, checking for hand hygiene, checking to make sure rooms were being properly cleaned, just trying to understand potential sources of hospital-acquired infections and trying to reduce them. And so I've had a lot of different experiences here. Those are probably the most memorable ones, but there's been plenty of different experiences. And I think anyone else joining the program would definitely find some pretty great experiences for them too. Skills that I used in the classroom that I used in my work was definitely a lot of my data analysis skills, epi, biostats. Specifically, my most recent project on the effect of the MMR vaccine on COVID-19 outcomes. I've been using all the skills that I learned in SAS to run regression models to analyze the relationship between the vaccine and outcomes. I'm learning how to control for bias, what factors in a patient might actually bias the results and how to control for them. So I've used that a lot in all my different projects. Really a lot of data analysis skills have been very valuable. In addition, I have also in the classroom learned a lot about different social determinants of health and community outreach. I've used that a lot in another project that I'm working on with the Virginia Center for Diabetes Prevention and Education, which I've been mapping social determinants of health, helping with flyer outreach to develop programs around Virginia that patients with diabetes can access from anywhere and help learn how to manage and better understand diabetes. And that's been really valuable because all the skills I learned in the classroom about social determinants of health, how access to healthcare can really, really improve an individual's health. And I've applied all those skills to that project. So definitely the data analysis and then community outreach / social determinants of health have been the two biggest skills I've been using outside of the classroom. It's been great to just learn, like go right from the classroom and then immediately like right after class, go use the skills I learned in a real world project. So it's been really valuable. So what excites me about public health is that I feel like we're studying the medicine of populations as a whole. So doctors study medicines of individual patients, but I feel as public health professionals, we are studying the medicine of entire populations. We are learning to treat disease, to cure disease, to prevent disease, just instead of at the individual level, an entire population. And that's been really, really interesting. And it's been exciting to see different types of research avenues that are open when we learn how to study things at the community level. The different types of bias that can be introduced, how to improve access to care, and also just the whole picture. I've done a lot of studies on cost effectiveness because if treatments cost too much, then they're really not going to be very useful to the patient. Also, access to treatments. Treatments are great, but if the patient can't get there, then they're also not very useful. So that's so exciting just to look at health from a more holistic perspective and at a population level instead of just by the individual patient. And it really just opens so many research avenues that have made me really excited to continue studying public health in the future. Advice I would have for anyone considering an MPH is, first of all, definitely go for it if you're interested in medicine research, any sort of population health. If you're interested in policy, that was not a track that I got involved in, but I know a lot of friends got involved with that and they have some really great experiences there as well. So if you're just interested in health from any perspective, whether it be from research, medicine, policy, definitely go for it. And if once you do come to the program, I would definitely recommend kind of keeping track of the things you learn along the way. You're going to learn a lot of different softwares that you're going to be using in real life for your jobs one day. And I learned maybe a little too late to kind of keep a dictionary of all the different steps you learn in the software, the different SAS code you learned, how to find different things in ArcGIS, how to map different stuff in Tableau. That stuff will really come in handy later. And if you kind of keep track of it as you go along, you'll create like little manuals for yourself that you can use in your job one day, because the skills you're learning in the classroom will definitely translate directly to your future profession. I hope everyone gets an MPH. I have definitely recommended it to a few friends of mine who have had similar interests of mine. So I would definitely recommend anyone interested in the area to get an MPH. It's a great field.